Next up we have Denson Lewin. What haven't you done? Where is he? Where are you, Denson?
I think it's me.
Hello. Staying so sly at the front there. Okay, so you're approved mental health professional, best interest assessor, retired forensic social worker, youth justice social worker and qualified youth worker. Amazing. Here today to talk about prevention and reduction in triggers of mental health. Thank you so much.
Hi everyone.
Hi.
I have to blame my daughter Sarah. Because of her, I was asked to attend. And, I'll have to see her later. I'm going to briefly touch on the causes of mental illness. There are health professionals use a number of tools to determine what's normal from what's abnormal. For example, the International Classification of Disease, 10th revision. And that tool is used to measure thoughts, feelings, behavior, and compare those with other thoughts, feelings, and behavior that might be to determine what's normal from what's abnormal. A bit nervous. Like you have various models, such as the medical model, you have the psychological model, you have the nursing model, and the social model, and the political model. And all those models are used to determine how best to intervene in children who have been diagnosed with mental illness. The health survey identified that 1 in 10 children suffer from mental illness, and that 11% affect boys as opposed to 8% girls. And the mental illness range from mild anxiety through to chronic depression. If you read the Daily Mail, I read it many, many years ago, and I don't read it anymore. But it indicated that 20% of children aged from, say, 1 to 18 suffer from anxiety through to mild anxiety through to chronic depression. And the causes that they suggest is like bullying, homework, bereavement, separation, divorce, drugs, alcohol, a whole range of contributing factors, because it is generally accepted by professionals there's no known cause for mental illness. What they suggest is that a range of environmental factors and also biological factors that contribute to the development of mental illness. So, for example, the precipitating factors include a lack of parental attachment, and Bowlby's attachment theory indicate that if parents don't give adequate attention to their children, then that may contribute to development of mental illness as they develop. For example, it is understood that parents who actually have other family members look after their children can have a detrimental effect going forward. It's not in every case, because it is recognized that some parents have to work and they have to use family members or extended family members to help to look after their children. It's just, but the lack of attachment because of excessive business work can actually negatively impact the child. Domestic abuse, marital breakdown, I'm repeating some of these, separations and divorce, abuses such as physical, sexual, emotional, psychological, and neglect. And these lists is put together by the World Health Organization. Also poverty, substance misuse, racism, sexism, bullying, educational stress, and so on, as I've mentioned. I repeat myself for emphasis. One of the learning ways that repetition is a good way of learning. and to ensure that the penny drops. So generally, these are the combination of factors or precipitating factors that can actually contribute to the development of mental illness. And it is the International Classification for Disease that determines, it's a list of symptoms, what they go through. They see if a child has a number of these symptoms, and then or signs. Symptoms is what you ask the child, and the child tells you. Signs are what you can observe. So for example, the child comes from school, they look sad. Parents should actually ask them questions to find out what is causing you to be sad. For example, my daughter, my oldest daughter is 40 odd. She came home from school one day and she really was sad. We sat around the back of the house and I asked her, said, what's wrong? She said, I'm not going back to school. I said, why? I don't like school. So I said, you get on well with the teachers? Yes. Do you enjoy physical education? Yes. You enjoy the meals? Yes. So what is it about school you don't like then? She said, I fell out with my friend. So she generalized and came home, lost her appetite, she wasn't eating, she was withdrawn, low mood, couldn't focus, and was ruminating on the pain, the hurt that she received from her friend. And because I was able to attack that and said, look, if she was really your friend, would she treat you like that? I said, a friend indeed is a friend in need. And the fact that she has treated that, maybe it's an indication to you that she's not really a friend. Immediately she perked up and she had something to eat and she went back to school. And today she's an established businesswoman working for a significant bank. Other children, some of them have been bullied at school, and I've been able to talk to them, share with them, go to school with them. And these kind of support help to prevent the development of mental illness. In my profession, I've come across a whole range of precipitating factors. I've met some brilliant people, A-level students, I've met a whole range of people from various professions who have had a whole range of low mood, high mood, and it's traced back into their childhood. They had child conduct disorder. And child conduct disorder speaks of behaviors whereby the child will maybe torture, insect, smash things, tantrum, throw things, behaviors that are uncontrollable. And in order for one to be diagnosed with personality disorder, you must have had child conduct disorder. That behavior must have developed and permeated every development stage of your life until the child is 18 to 21. Most psychiatrists don't like to diagnose that child until they reach the age of 21. But the emotional, unstable behavior disorders are seen from an early child age. Sometimes it's identified as attention deficit hyperactivity disorder or hyperkinetic, the same meaning. And that behavior, sometimes they dealt with emotional behavioral difficulties, and nothing seems to work. And that child is so traumatized that they use substance as coping mechanism, and it exacerbates their situation rather than alleviate it. Good family support can actually help that child. If parents can take time out, sometimes it's sexual abuse. Sometimes that's the reason. And it's not necessarily in the nuclear immediate family or the extended. Sometimes that sexual abuse happens within the playground or outside of your control. Ask the child the question, who told you not to tell anybody? That's very important. We had a Ray Wire from the Home Office come to talk to us about child abuse. And sometimes school teachers, scouts, very patient, very meticulous, and they will seek out education and get jobs as scouts, teachers. And they will get into a position whereby they manipulate and use that child and persuade them that what they're telling them is normal. And one of the key things is that they tell them not to tell anybody. So ask your child, who told you not to tell anybody anything? Who touched you and told you not to talk? It's very important that you ask those questions. The other thing is that I've learned with working with psychologists, forensic psychologists, is that because questions, open questions and closed questions are not asked. I'll give you one example. I can't go into detail, but I know of a situation where one person, a brilliant student, hadn't had the attention, and that person developed a disorder. And as a result, that disorder has not been treated, even though that child has had significant input from all disciplines. It hasn't made any difference because it had been left too late. It germinated, it grew, it became established. And that person has had significant input, but has not been able to benefit from that. The ICD-10 identifies 6 types of personal disorder. The DSM-4, that is the American version, the Diagnostic Statistical Manual, identifies 10 types, ranging from, for example, as mentioned, emotional and personal disorder, borderline personal disorder, and also antisocial behavior. They call them dangerous and severe personal disorders as a legal definition under the Mental Health Act 1983, amended 2007. And those are mainly talking treatment. Medication doesn't work. So those things can be prevented if parents are observant and ask the question. Recreational is a key to prevention. Holidays if you can afford it. Reading to the child. All those things that you know are good ways to prevent. Medication has its role, but it's not the be-all or end-all of preventing or alleviating mental illness. I repeat these models. The medical model deals with a scientific approach and is pharmaceutical intervention, it's medication. No individual model is the be-all or end-all of any intervention. People are holistic. You need a combination of parental intervention, good. There's a poem that says that the hand that rocks the cradle ruled the world. And that's parental intervention. Plenty love and support. And see medication as a last resort. But it's really talking treatment, it's good family network, and also talking treatment via GP and agencies to Rethink, Mind, a whole range of people you can use, Samaritans you can use to help. My time's gone. Thank you.
Anyone have any questions for Denson while we're here? Yeah, Denson, do you mind? Thank you.
I'm just interested in what your thoughts are about mental illness being something that runs through families and being hereditary.
Yes, research has shown that parents with mental illness, schizophrenia, psychosis, their children are more likely than others to develop mental illness because it's the environmental, it's not just hereditary, because research, for example, I'll give you something. Research has shown that 50% of children who have been abused or even have had parents with mental illness have managed to grow up and become excellent parents, more so than those who hadn't had those problems. They call those the resilient children. But those only happen because they have good support from the immediate family and extended family. And so although they've been recipient of maybe the biological hereditary factor and also negative environmental factors, somehow, because of the parental, extended, and other agencies' support, that resilience, that potential in that child have been realized despite the barriers to that child developing their potential. That child overcome those barriers with good positive support, even though they have the propensity based on the hereditary factors to develop those mental illnesses. Is that?
Thank you. Anyone else for questions? I have a mic. You'll be heard. Don't be scared. Thank you.
I was interested when you used the phrase parenting can have a sort of positive impact. I just wonder if you felt, I suppose from my observation, it feels like women do a lot of the emotional support in a relationship, in families. And I just wondered if you had any advice on how men, sorry, this is a generalisation, of course, were able to start not being afraid of their children's feelings. Sorry if that makes sense.
Yes. It is said that women are relational and men are positional, and men tend to display the tortoise effect, and they're not comfortable with dealing with emotions. It depends on the environmental in which one has been developed. Some men are one parent and they grow up their children and they do exceptionally well. But that's because the systems to which that child is connected, what one doesn't get from the father, they can get from others. And the same is true because you have one parent, family is female, and the female parenting has to have support from other network, in order to balance out the child. But it is generally the case that men tend not to deal with emotion very well, but it's not all men. Some men do and some men don't. And if males have had problems in the past and they haven't had their emotional difficulties addressed, it makes it very difficult for them in parenting. Because when their child comes with emotional difficulties, that person, that man, will find it very difficult. But I see male and female, or in terms of the question, context of the question, working together. You have positive and negative, and if you have £1 million car, unless there's positive and negative in it, that car is not going anywhere. But you can balance it out between you. Know your strength, know your weaknesses, and share. Does that help? I don't know if that answered the question.
Thank you. Anyone else? That all good?
I think that one put them off.
You're perfect. A round of applause for Denson.